The Biden administration sounded the alarm today about a surge of COVID cases in some states and the direct connection with low vaccination rates. The Centers for Disease Control reported about 33,000 new COVID cases in the U.S. yesterday. That is a rise in new cases of about 70% compared with a week ago. Hospital admissions are up, too, by 36%. And the average death toll of the past week has climbed to 211 people a day. During a briefing today, CDC Director Dr. Rochelle Walensky and other top officials outlined the danger.
This is becoming a pandemic of the unvaccinated. We are seeing outbreaks of cases in parts of the country that have low vaccination coverage because unvaccinated people are at risk.
One of the reasons for stubbornly low vaccination rates is misinformation, erroneous or outright false information that may dissuade some people from getting a shot. The White House has been particularly focused on this and the role of social media in allowing false information to spread. On his way to Camp David today, President Biden laid unmistakable blame on Facebook.
What's your message to platforms like Facebook?
They're killing people. I mean, look, the only pandemic we have is among the unvaccinated, and they're killing people.
Facebook said the president was wrong. In a statement, the company said, quote, more than 2 billion people have viewed authoritative information from Facebook about COVID and vaccines, more than any other place on the internet. All of this comes as concerns over COVID are spiking regionally. This afternoon, Nevada officials recommended the use of masks in Las Vegas in crowded indoor spaces. The rise in cases and hospitalizations around the U.S. is particularly bad in parts of the South and the Midwest. That's where Lisa Desjardins picks up the story.
Judy, to get a sense of this, take a look at the map of hotspots where COVID cases are rising. 2 months ago, there were no red spots on this national map, but today there are a significant number of states that are red, representing new cases and positive tests. In fact, 7 of the 10 counties with the highest percentage of new cases per capita are in Missouri and Arkansas. And Arkansas's new cases have risen by 121% over the last 2 weeks. We look at the situation in that area and the concerns about the unvaccinated with an epidemiologist for the state of Arkansas, Dr. Jennifer Dillehay. Dr. Dillehay, take us into what the situation is right now with the coronavirus in your state.
Well, we are a state right now that has low vaccination rates. And at the same time, we're having a great deal of spread of the virus that causes COVID-19, but it's the new Delta variant, which is highly contagious. So it's leading to a surge in cases and a great increase in the number of hospitalizations in our state.
I want to talk more about the vaccination rate. You do have one of the lowest vaccination rates in the country, about 35% of your population. What do you know about why that is?
It's multifactorial. Part of it is that people don't understand the urgency of being vaccinated. We're a rural state, so there were many rural communities that weren't really particularly affected this last winter. So they underestimate the potential for the disease to spread in their communities, and they're underestimating the infectiousness of the new Delta variant. And then on top of that, there is a great deal of misinformation out there, and people struggle with telling the difference between the misinformation and the accurate information. So they're unable to make an informed decision to get vaccinated because they struggle with understanding what the need is and what the risks are. And then on top of that, we have low healthcare providers in our state. We have underserved areas, so we have worked really hard to get vaccines out into the rural communities through our pharmacies, because oftentimes it's the pharmacies that's the only healthcare provider in the town.
On that idea of misinformation, we're seeing reports that sometimes there's even hostility now, people, including your governor, to presenting the facts about the dangers of the coronavirus. How do you combat that? At this point, you have put out the message. What can you do?
Well, I think one thing is to have empathy and compassion, and then to help people address their concerns about whatever they have. They need to be heard and then supported to move to a new position where they can accept new information.
You mentioned the Delta variant here. How dangerous do you believe that is?
I think that the Delta variant is very dangerous. It is highly contagious. It's very quick to put people in the hospital and at younger ages. So I think it's going to be hard for people to make decisions if they're basing those decisions on their experience of this past year. This is new, and people are underestimating it.
How are your hospitals doing right now with this surge?
So our hospitals are full, and not so much with COVID cases right now, but with cases that have resulted from delayed care or other health conditions that need immediate attention. And on top of that, the staff are tired. They have worked so hard over the last several months, and they're not getting a break, and they really need a break. We looked at our hospital numbers in the last several days. They're increasing every day for the past 2 weeks or more. And at the current rate of increase, we will double our hospitalizations by the beginning of August. And at that point, we will be at the peak in terms of our number of COVID hospitalizations where we were in the wintertime. It's very concerning.
You know, around that same time, just a month from now, is when freshman orientation begins at the University of Arkansas. Students will be back a few weeks after that. There is a home football game scheduled, tens of thousands of people. What is your concern level about that? Is there a conversation about whether those things should go forward?
So we do have a concern about those things, and it's really important for people to follow public health recommendations, which are, if they're not vaccinated, to wear masks and practice social distancing. I think in the current situation with schools starting, that's going to be very difficult for people to adhere to. And for that reason, we are strongly urging people to get vaccinated, get fully vaccinated as soon as possible.
A strong and important message, Dr. Jennifer Delahaye of the state of Arkansas. Thank you for joining us.
Thank you.